What causes panic attacks? Some researchers think panic attacks are like false alarms, where our body's typical survival instincts are active either too often, too strongly, or a combination of the two, versus a panic disorder, which is a form of a mental disorder, which is characterized by recurrent, unexpected panic attacks. For example, someone with panic disorder might feel their heart is pounding excessively and assume they are having a heart attack. The second question is someone can ask me is, how do I know if I am having a panic attack? You have to understand that panic attacks can be frequent or unexpected. Panic attacks can occur at any time, anywhere. In fact, many people with panic attacks or panic disorder, they worry about the possibility of having another heart attack. Okay. Now, so what are the signs and symptoms? What are the signs and symptoms? You would see a person experiencing panic attack and panic disorder. This person may have a fear of avoidance of places where the panic attack have occurred in the past. Okay, they might notice their heart is pounding hard or racing. They may experience sweating all around the body or a specific part of the body like their palms. They might experience chills, trembling. They might experience difficulty breathing, weakness or dizziness. They might experience tingling or numbness in their hands or their extremities, like their foot. They might experience chest pain, stomach discomfort or nausea. Okay, now let's talk about the treatment of panic disorder or panic attack. The first step in management is for you to obtain a diagnosis. And how do you do this? You obtain a diagnosis by having a conversation or have an appointment with your medical provider. Some people are being managed by a psychologist or psychiatrist, family medicine doctor, or your mental health professional. They might actually walk you through the diagnosis. Now, if you notice after you obtain a diagnosis, most of them might recommend what is called psychotherapy. A very good example of psychotherapy they might recommend you for is the CBT, which is a cognitive behavioral therapy. CBT teaches you coping mechanisms. You know, it teaches you different ways of thinking, behaving, reacting to the feelings that happen on or during the panic attack. So someone can ask me, what are the common medications that are used for the treatment of panic attack? Usually antidepressants. Some of the medications that are used for the treatment of depression can be beneficial for the treatment of management of panic attack. For example, such medications are referred to as the SSRIs, the selective serotonin reuptake inhibitors, and also the SNRIs, which are the selective norepinephrine reuptake inhibitor. And some medications such as the beta blockers can be effective. Sometimes when I have a patient comes in with heart palpitation, I often, prescribe beta blockers like propranolol for maybe 14 days, and then we take it from there. And also an anti-anxiety medication such as benzodiazepines. I try to stay away from this kind of medications due to safety. And so another question someone can ask is, how do I support myself and others with panic attack or panic disorder? The first means is this one you are doing right now is by educating yourself. You can actually read more about it. And the second thing you can do is to communicate. Make sure you speak and make sure you express yourself, speak to people who can help you, and also learn your coping mechanism. When you learn to cope with it, it actually allows you to deal with it and understand this, how you're going to stay calm under this emergency situation sometimes. Okay? I hope you are able to learn one or two things from this presentation. You take care of yourself and be well. Cheers.